All right, good afternoon, everyone. So welcome to the South Texas Regional Family Medicine Grand Rounds. Next slide, please. So thank you all for muting your microphone once the presentation begins, being attentive to the presenter and engaged in the session, keeping your cameras on when appropriate, registering for the CME credit, and then completing and submitting a session eval form. Next slide, please. So here's the activity code for today. I'll leave this up here for a little bit for you all to get your CME credit. All right, next slide, please. And here's just more information regarding getting that CME credit via text. I'll leave this up here for a little bit as well. All right, next slide, please. And then this is just information regarding CME transcripts and how to access those. All right, next slide, please. And then this is just information regarding the AAFP credit system. And next slide, please. And then this is just a slide about the core competencies. All right, next slide, please. Katie Wiggins has no financial relationships with ineligible companies to disclose. Next slide, please.
All right, here I'm taking over. Thank you, Catherine. So today, can you all hear me okay? Yeah, okay. So Dr. Wiggins was born in Texas, who went to medical school actually here in Utasca after completing her general surgery training at Baylor Scott and White, where she also spent dedicated time in a basic research lab examining vascular permeability in the setting of a trauma. So I believe that had driven her interest in trauma surgery and maybe in the little patients in the pediatric world. So after the residency, she had also completed this pediatric surgery fellowship at Oklahoma University. Then she became a faculty at University of Colorado before coming here, joining the faculty team in the summer 2022. Now she's here presenting her passion in pediatric trauma prevention, specifically with the firearm injury prevention. Thank you, Dr. Wiggins.
Okay, yeah, thank you guys so much for having me. And for that background, I am a pediatric surgeon. I am the pediatric trauma medical director here at University Hospital. But I did try to make this talk geared to all spectrums of patients, because I know not everyone treats just children. So I did include some adult stuff here. So hopefully this will be more appealing and applicable to you guys. But like was said, I do have a passion for firearm injury and hopefully can ignite some passion in some of you as well. And so let's see. So before we get started, this talk is part of a survey research project that we're doing here at the Health Science Center. So if you are a Health Science Center or UT faculty, resident, or medical student, and you wouldn't mind participating in this study, what we're trying to look at is where people's knowledge is regarding firearm injury prevention, and then basically how efficacious this talk is. And so if you don't mind scanning this QR code, that'll take you to a survey. Please complete the survey, but then leave that window open. Because at the end of the talk, there are some, if you close the survey, then you can't do those after the talk questions. So just complete the survey, leave it open, and then answer those questions at the end. And so I'll give people just a few seconds to complete that survey before we get into the meat of this talk. All right, so I'll give you guys maybe like 1 more minute. Hopefully people are wrapping up, completing that. Okay, so this project, both sort of the goal of talking to people about this and this survey, stem from an experience I had a couple years ago where I was in Colorado taking care of a patient. She was about 11 and um, essentially found an unsecured firearm on her parents' bedside table and shot herself with it. And so from a trauma standpoint, I took her to the operating room. We, did surgery on her. She did okay from a trauma standpoint, but I was trying to learn a little bit more about how that injury happened. And so I was talking to her parents, and they told me that she didn't really have a history of mental health issues. And I ended up calling her pediatrician to just let the pediatrician know that I had, was taking care of her patient, see if I could get a little bit more information about her mental status. And in talking with the pediatrician, she shared with me that she'd seen the patient for a long time and that she had, been made aware that the patient had some mental health issues. She said that mom and dad had recently separated. She knew dad was in the military. And she actually, their office had a form that they had patients fill out, noting whether or not there were firearms in the home. But the pediatrician said she didn't really feel comfortable talking to the family about any firearm issues because she felt like it was a really touchy subject. And so, at the end of our conversation, the pediatrician said something to the effect of like, gosh, I wish there was something I could have done to help prevent this from happening. And I found that sort of as a little bit of a shocking moment, because when I read like the American Academy of Pediatrics recommendations, they recommend that pediatricians do speak with families about firearms. And so I started thinking, why wouldn't this pediatrician do that? And I started thinking back to my own experiences with my kids. I've got a 17 and 18-year-old now. And through the years, none of their pediatricians, who I think are really good doctors, had ever brought up any firearm questions. And I thought, why isn't this happening? Why don't we, and I include myself in that, as healthcare providers, do a better job of having conversations? And what can I do on an individual level to try to help with this? And so that's sort of my impetus for looking at firearms a little bit more. I know that may not apply to all of you, so I tried to come up with a scenario. I know I'm not a family medicine doctor, but I think people learn better when you use clinical scenarios. So I don't know if this ever happens to you guys, but I thought maybe if you're, covering some inpatient service and the ED calls you and they want you to admit a guy with a self-inflicted gunshot wound to the left great toe. He's got a wound that's through and through, and you're asked to admit by PD in the podiatry service for some wound care. Sorry about that typo, that's supposed to say wound care. What would you do? And when I ask and I put myself in this group, when I ask surgeons the same type of question, and what I would do a year ago or a couple years ago, is I would work on the admit orders and move on to the next patient. But then I start thinking, well, are there other things? Should we be calling social work? Should we counsel families on firearm safety? And I pose those same questions to you. Should we be doing that? And I'll tell you, based on the one patient that sort of was the impetus to this project, my opinion is yes, we should all be doing that. We all have a role to play in the firearm epidemic. And I'm going to spend the next few slides trying to convince you that the answer to this question is yes, we should all be doing this. So I'll be very upfront and be very transparent. I'm going to share a bunch of very shocking statistics with you guys in the hope that these will convince you that we should all be treating this like the epidemic that it is. And so first off, I'll share with you, this is a huge problem. So in the US, we don't have a very broad, all-encompassing firearm injury database, but we do have some organizations and some groups that are trying to cobble together some numbers for us. And so from those numbers, we estimate the deaths in the United States from firearm-related injuries to be, in the year 2020, were about 45,000 people. And so if that number sounds really hard to grasp, that's about 124 people per day, or on sort of a smaller level, that's about 5 deaths an hour. So in the time that we're going to go through this information and do this talk, 5 people in the US are going to die from firearm injuries. And so to me, that is like a astonishingly huge number. When we break this down and we say, okay, well, what does that look like in Texas? That is about 4,000 people a year that die in Texas, which is a lot of people. When you look at how many people are wounded by firearms, so not deaths, but firearm injuries, we have even less of a good idea how many people are wounded by firearms. The estimate is a little over 5,500 in just the state of Texas. But again, there's no national database for this, so we don't know how many patients maybe see a primary care doctor and have a wound, and that doesn't get registered somewhere, or may even go to the hospital, and that information isn't really gathered. But this is a good estimate, and even assuming that this estimate is low, that's still a ton of people. 76,000 people in the US, or 5,500 in the state of Texas. And if any of you are sort of very numbers driven, like I have a partner who's getting his MBA right now, so he likes to hear about numbers. When you look at the economic impact of the deaths, lost years of work, healthcare costs, etc., of firearm injury and death in the US, it's about $550 billion. And so to me, that is a huge number. That translates, like for the state of Texas, to cost about $1,700 per Texan each year. And so that these to me are very, very big numbers. If you're not convinced yet, don't worry, I have more information. So when you look at just pediatric deaths and causes of death, in 2020, firearm-related injuries became the #1 killer of children in the United States. And so firearms now in the US kill more kids than cancer, than congenital abnormalities, than heart disease, and even more kids than motor vehicle crashes. So this is a very uniquely American problem in what I think of a very bad way. So guns are killing more kids here than anything else. And if you think of children and firearm related injury, it may be easy to make the assumption that okay, well, most of those deaths are probably from teenagers that are involved in gangs. And, that makes the numbers kind of skewed. And, maybe the problem isn't that bad with kids. But when you look at the actual number of children, there's sort of a bimodal distribution of kids that are involved in shootings. And there is, as you can see here, a high number of teenagers involved, but there's also almost an equal number of kids less than 5 involved in shootings. And so, these are kids that find unsecured weapons that either shoot, kill, or injure themselves, or most often a family member. And so, I mean, if I haven't convinced you this is a huge problem, here's one more slide. So when you look at just firearms injury links to youth, there was a recent study here that asked kids, how often have you carried a gun in the last year in a non-recreation setting? So these are not hunters. 1 in 15 boys had, and 1 in 50 girls had. And so, you think like that is a very startling statistic. And so hopefully I've convinced you that this is a huge problem. I think this affects every realm of healthcare, and, especially primary care, frontline healthcare providers. So, when I think about identifying a huge problem, the next question for myself is, what can I do about this, on an individual level? And, I have to be honest, the more I looked into firearm injury prevention and firearm related injury, the more complex it seems to be. There are so many factors that affect firearm injuries, firearm risk factors, and there is no simple solution. And, the more I learned, the more it just seems like a very convoluted sort of web of factors contributing to other factors, and that putting patients at risk. And for me, then it gets very overwhelming, and I ask, like, well, what can I do about that? So one thing that I tried to do is, I'm an active member of the Pediatric Trauma Society, and they have a website where there's a free section on that website called the Pediatric Society Hub. And the goal of that is to make sort of a one-stop shop for people looking for advice on the care of pediatric trauma. And the goal is to put a bunch of guidelines on there to make it easy for non-pediatric surgeons to find the latest, greatest guidelines on how to care for pediatric trauma patients. So to anybody. But anyway, on there, there's an injury prevention tab, and under that tab is a subheading for firearm injury prevention. And so I put this chart on there, and I'm sharing it with you today to just sort of hopefully illustrate how complex this is and how many different things go in firearm injury prevention, we think. This is a chart that goes through different suggestions made by APSA here. APSA is the American Pediatric Surgical Association. ACEP is the American College of Emergency Physicians. ACS is COT, that's the American College of Surgeons and the Committee on Trauma. AAP is the American Academy of Pediatricians, and then AMA is the American Medical Association. And so you can see here, there's a bunch of different suggestions here: promote gun education, etc. And then these are just recommendations from these different organizations. And so I show this to illustrate the complexity of the problems. These organizations have, sort of multifaceted suggestions. So to me as an individual, it's very overwhelming to think, okay, what on this chart can I do? And so when I look further into things, the American Academy of Family Physicians actually has like a great almost like a one-page, it's like a web page site, and here's the QR code to that, that has some recommendations that I wanted to share with you guys today. You may be familiar with these, but just in case not, they recommend in the clinic setting that physicians know the rate of gun violence in their area to understand the impact for their patients, and that they ask patients and families if there are firearms in the home. And if the answer is yes, they discuss safe storage. And then they also screen for depression and intimate partner violence, which is important to guide your safe storage discussions. And so to me, that's something that, okay, I can have conversations with families. And so we'll talk about how to do that in just a minute. But that first recommendation, when they recommend sort of knowing your area. So this is a map of the United States. This is a data map from 2008 to 2014. And it's looking at age-adjusted death rates from firearm homicide in the United States. And I know this is like a very busy slide, so I blew up the state of Texas. And for your reference, like really dark reddish orange is the highest rate. And that arrow is pointing to Bexar County. And so our rate is, according to these different classifications in this particular map, in the highest category for this map in the United States. So it's a big problem here in the United States, but also in Bexar County for our patients. And so, then if we look at that second recommendation from the AAFP, say, okay, use your voice, ask questions. And that sounds great, right? So when you start like looking online, you can see all these different mottos. So here's some, it doesn't kill to ask. The number one killer of kids has met its foe. Just ask a question. And that sounds great until you're sitting with a patient and you're thinking, okay, wait, this is a super awkward conversation. And, I grew up in Texas. My family I grew up on a ranch. We had actually a gun cabinet in the kitchen. So, I understand the audience here. This is, Texas. And so having conversations about firearms and firearm safety can be super awkward. So it's not really just as simple as saying, hey, you should ask. So my one of my goals here today is to talk about how to have that conversation and hopefully give you guys a framework that will make having that conversation a little bit easier. And lucky for all of us, there's a great organization out there. This is a not-for-profit based organization out of California that has put together a program called Bullet Points. And there's a QR code here that'll take you to the Bullet Points website. And that website is full of tips and tricks for how healthcare providers can have these conversations with patients and family members. There is a whole course that you can take. It's free. You can get CME for it. They have video illustrations. But in case, I know we're all busy, in case you don't have time to do that, I've tried to condense that down almost into like a Cliff Notes version, and I'll go over that now with you. This is a great framework. I think we should all be cognizant, that this is not going to apply to every situation. It's not going to be perfect. Nothing in medicine is, right? We all know that every one of our patients doesn't read the books, and, there's not one size fits all when it comes to treatment. But hopefully having this framework will empower you to feel comfortable having conversations with families or patients, and develop your own style for how to do this. But this gives you at least a starting point, and hopefully will make it easier to broach this subject with your patients and families. And so what Bullet Points does is it sort of breaks it down into these 3 A's. So the first is approach, the second is to assess, and then the third is to act. And so this approach, the one at first, basically encompasses 4 different elements. So it's, let's be informed, be respectful, focus on harm reduction, and then be individualized. And so I think all of this is to try to help us understand that our patients are all different. They own firearms for different reasons. And so helping them be safe with firearms may look different, right? From one family to the next, it's not going to be the same. People don't own guns for the same reasons. They have different sort of factors that play into how they live and the things that are important to them. And all of those should be considered when we're having conversations with families. And so, this is just a little illustration of, some of the things that can affect people's choice to own firearms. So, of course, there's like individual things that affect both their health and their choices that they make. There's relationship things that play in. There's community factors, and then there's societal factors. And all of these are going to have an impact on the choices that they make about how they live, and in turn, the choices that they make about firearm ownership and how they're going to sort of live with those firearms, right? And we need to be cognizant of all of these things. And so while there are lots of differences in the reasons that people own firearms, in their backgrounds, in the factors that play into how they live their life, there are a lot of similarities. And for me, sort of treating this like something that I approach with every patient has made a big difference. And so my personal recommendation, the recommendation of bullet points, is that all patients be screened for firearms in the home. And we'll get into some techniques in a minute, but I'll tell you, like in my elective pediatric surgical clinic, when I see patients that come in for, an inguinal hernia or a gastrocutaneous fistula or, whatever, they all get asked about firearms in the home. And that's just made it, it's part of my, I do HPI, past medical, past surgical, meds, allergies, vaccinations, and then I ask them safety questions, and firearms is one of them. And, I think the key to some of these conversations is to be really non-judgmental. And so here are some examples. You guys can read this, but you could say something like, some of my patients that have guns in the home choose to make them less accessible due to children. Would you be interested in discussing this? Or, an example, I gave of my clinic. What I do in my clinic is I go through stuff, and then I tell families, okay, I'm going to ask you some general safety questions that I ask all my patients. And I try to sort of start off with some more softball type questions. And I say, does your child always wear a seatbelt? Are they properly restrained in the car? Yes or no? Then I say, okay, when your kid is on anything with wheels, bikes, tricycles, scooters, whatever, do they wear a helmet? Yes or no? We talk about helmet safety. And then I say, another question that I ask all my families is, are there firearms in the home? And before I let them answer, I go on to say, the reason I'm asking is because I really want you and your family to be as safe at home as possible. And if there are things that I can do to help that, for example, we have free gun and trigger locks here, then I'm happy to discuss those things, or to give you some free trigger or cable locks. And, on a personal level, anecdotally from my clinic, I've had very positive responses from families to that. And so not that that's a one size fits all, not that that's the way that you should do it, but just as an example of one thing that you could incorporate into some of the conversations that you have in your clinic. And so I think just to elaborate on the importance of the understanding where people are coming from with regard to their firearm ownership, things that I have sort of thought about is, if you have, a single mother, for example, that lives in a high crime neighborhood and, has a child, she may feel like she needs to have a firearm in the home to be safe. And so, if I don't understand that and I'm talking to her about, the ideal safe storage is the gun is, stored securely and unloaded, and the, ammunition is stored separately, that's going to be a turnoff right away. She's not like, that's not something that's going to work for her. And so I feel like for me then, as a healthcare provider, to try to essentially make her conform to what my ideal safety is not helpful, and that's not going to make her more safe. So me understanding why someone has firearms is really helpful to help me assess her situation, and then for us to figure out together a way that we can figure out how can we make firearm ownership more safe in her home. And so I hope that, makes sense. So once you have an understanding of somebody's background and can use that to consider how you can help them, then you can start thinking about their risk factors, any threats that may be present in their home, their access to their guns, and then their willingness to collaborate. And this kind of then can help guide you on the actions that you may want to think about taking. And so these last two sort of rungs in the ladder, if you will, are sort of lumped together. And so as we go through, then we'll talk about different conversations or different things you can think about based on what you assess to be the level of risk in the home, and then where you take your action based on that risk. So risk factors in the home for increased rate of firearm injury or death are things that many of our patients have. So these are things like mental health disorders, substance misuse, a history of suicide attempts or violence, intimate partner violence or domestic abuse, dementia or other types of cognitive impairment, recent relationship or job loss, storing guns in ways that make them accessible to at-risk people, and then having children in the home is also a risk factor. And so, when you think about risk, many of our patients are at risk because so many of them fall into these categories. So when you think about high-risk populations, these are populations that sort of kick it up a notch when you think about how aggressive should you be in your efforts to help them. And we'll talk a little bit more about what that means in a minute. But high-risk populations are patients with a history of depression or suicidal ideations or suicide attempts. If they've been previously injured by a firearm, dementia, or children living in homes with firearms. And so obviously there's going to be considerable overlap. I know many of you know, like, lots of things in medicine don't fit into nice little boxes that we like them to fit into. Even like, something like appendicitis, you can have, different severities of appendicitis, right? So a lot of this, there's some overlap, but it's like that typical stuff in medicine where it doesn't fit into nice, neat boxes. But hopefully you guys kind of get an idea of trying to put people on a spectrum of, do you feel like they're sort of moderate risk or super high risk, and assessing that, and then helping that guide where you're going to take your conversation and what you offer to that patient. So for lower risk patients, the recommended intervention is safe storage. And so to discuss safe storage, so concerns with this approach to firearms with patients with low risk are people who have firearms for safety. I mentioned the single mother in the high crime neighborhood. They may be super hesitant to store their firearm, locked, unloaded, etc. So you may meet some resistance with this approach. But there are ways that you can try to work together to improve the safety overall. And so, we talk about what does it mean to talk about safe storage. So ideally, this is an ideal situation. You're going to talk about sort of the three things that I've mentioned before. The firearm is locked, the firearm is unloaded, and the ammunition is stored separately and also locked. But this, again, may not be something palatable for all our patients. So in my opinion, it doesn't mean it's like an all or nothing thing. People either store their firearms exactly like this, or, you recommend, okay, you need to get rid of them. In which case I suspect you'll lose a lot of credibility with that conversation with that family. It may be that you say, okay, if you feel like you need to have your firearm loaded, can we make sure that it's securely stored, maybe a safe or a lockbox, or, with a trigger lock. And I'll sort of show you guys pictures of all those in a second. Just like if you have a patient who's smoking 3 packs a day and you say, hey man, like, you really should, cut back on the smoking. You're not going to like kick that patient out of your clinic if they say no. You're going to say, okay, can you try to cut it down to 1 pack? And, I would be very happy if I had a patient who was smoking 3 packs a day and then they went down to 1 pack. I would consider that progress. So, this is, again, not nice, neat little boxes, but lots of places that we can help our patients be safer. And so, options for safe storage are, I mentioned a lockbox. So that's this picture here. So lockboxes start at about $250. There are some places that have free lock boxes. We're working on that here. We don't currently have that, but you know, depending if you're a resident and you go to work somewhere else, if you moonlight other places, there are some institutions that have free lockbox programs. So, you know, if patients have to buy them, you know, $250 may not be something that every patient can afford. But this is a good way to store firearms. Some of them will have a key, or other will be fingerprint activated. And so, you know, you can at least be aware of this when you're having conversations with families. Sort of one notch up from that would be a safe. So if a patient has a lot of guns or a lot of firearms, this is a great option. These are even more expensive than a lockbox. Safes start at around $2,000-ish. And so again, that may be economically prohibitive for some patients, but it's certainly something to discuss. On the more economic end of the spectrum are things like cable locks and trigger locks. So a cable lock, you can see it sort of goes through the gun and prevents it from firing. Obviously, the ammunition cannot be in the gun when locks are put in. And so in my experience, this is less popular than a trigger lock, which you can see here goes on the trigger and prevents that from firing. But the upside of these kinds of safe storage devices are they're very economical. So a cable lock can run you about $10. Trigger locks are maybe $12. It's not infrequent that these will be given away for free with purchase of firearms at different retailers. And also, if you're at University Hospital, we have free trigger and cable locks. So at the end of the presentation, I provide you with both my email address and the injury prevention program here at University Hospital. And so if you're in a setting, if you are in a clinic and you guys want to start carrying cable or trigger locks, like please reach out and I can try to help facilitate that. Or if you're just in clinic and you have a patient and they express interest in these, please feel free to email me about individual patients and I can try to help get them trigger locks too. Because in my mind, you know, one more gun, even if it's just one gun that's stored more securely, if that can help save somebody from an injury or a death, like I'm happy to do anything I can to help facilitate that. So sort of the next notch up as far as intensity would be patients that you consider maybe a medium risk, you know, so somebody who's having you know, maybe a little bit more of a mental health exacerbation, or that you know has some things going on at home that you're a little bit more worried. So things that you can do for them is have a conversation with them about temporary transfer of firearms until that acute crisis is passed. So on the Bullet Points website, there's like a little video that you know goes through like this whole conversation. I didn't want to belabor this here by showing that with you today, but you know, you can have conversations and just ask, like, you know, is there somewhere else you can keep your firearms for a little while with a family, a friend? Some gun shops or even firing ranges will hold firearms, and you know, just having them essentially, you know, one step away from a patient in crisis can make things safer. So, you know, talking about concerns with this method in this situation is, you know, how do you determine when guns can be safely returned? And this does require patients to be cooperative and you know, have these conversations with you. But it doesn't mean that you shouldn't think about this or know that this is a technique that you can use to try to make patients safer with their firearms. So then when you get on to, did I skip? Yeah, okay. So, you know, the next would be if you have someone that you feel like is just a little bit higher risk of that. You know, if they have expressed, you know, explicit statements of wanting to hurt themselves or hurt others, you know, you can have a mental health hold placed on them. Healthcare providers can initiate this, and that obviously puts them in a healthcare facility where they should not have access to the firearms. This, you know, concerns with this are, you know, sort of what happens to that patient when that healthcare I'm sorry, when that mental health hold has expired, you know, usually patients don't have a mental health hold, and then, you know, as soon as that expires, they're, you know, in a quote unquote better place. Um, think about, okay, what if you're going to initiate this, what do you do after that to help them continue to be safe? And then the most extreme would be an extreme risk protection order. And so this is temporarily removing firearms from someone who is at immediate risk of harming themselves or others. This is not something that every state has, and in fact, Texas does not have an ERPO. But I include it here so that we're all made aware that these do exist. And as I know, this is a training facility. If some of you go to practice in other states, this may be something that your state does have. And so I think it's important that you know that this is an option. And so, you know, just a little bit more detail about this option. So this allows for the temporary removal of firearms from individuals. It does not require a criminal history, activity, or mental health history. It can be requested by law enforcement, family members, or employers, and then some states do allow medical professionals. And so here's a list of states that do allow ERPOs. So if you are finishing up your training and thinking about going to one of these states, I just include this so you just have, you know, a lot of information and resources about things that may be options for you should you be in this situation. And so, you know, when we're talking about laws surrounding firearms, another thing that I think is important to discuss in, you know, what I hope is an informative session on firearm safety and laws are child access protection laws. So these are laws that impose penalties on individuals who don't properly store firearms. And so Texas does have a cap law, and you know, I think it's good. We have one. That's great. The way this is worded, the way it's implemented in different states varies a lot. So you know, like I've said, many things aren't a one size fits all. But this at least is a start here in Texas that we do have child access protection laws, which essentially can criminally penalize people for not storing their firearms safely should something bad happen to a child. So, you know, talking about more Texas specific things and to try to give you guys more resources. Gun Safety for Bear is a program here in Bexar County, and then University Health Injury Prevention has partnered with Gun Safety for Bear and a lot of other organizations here to provide free gun locks. So I mentioned the cable and trigger locks to you guys. They also give gun safety storage presentations out in the community. And so, you know, I mentioned earlier that I talked to families in my clinic about firearm safety. You know, when I first moved back to Texas, I was a little bit nervous about that, just knowing the environment here. And I've had very positive reactions from family members. And in fact, one family I talked to about this got so excited that we were having this discussion that he wanted like tons of resources. He wanted people to come talk to his men's group at his church. And so I was able to hook him up with the injury prevention program here and, you know, provide more education to community members through these great resources that we have. So that is a QR code to help link you to these resources locally here for us. In the vein of trying to inundate you guys with all kinds of information, here are even more resources. So Be Smart is a campaign mainly aimed at children, but it has resources to provide patients and families with information on safe storage. And there's a QR code to their website. And then the American Academy of Pediatrics actually has a really great, very comprehensive gun safety toolkit with lots of handouts for patients and families. They've got handouts in both English and Spanish, and lots of good education. So I include this again to inundate you guys with lots of information. And then, you know, as a final resource, I think Everytown for Gun Safety is a good thing to leave you with. So this is a nonpartisan organization that works hard to, in my mind, and I'm making this very simple, but to try to get numbers surrounding gun violence in the US, and then use those to help move legislation towards safer gun laws. And so this is a QR code that links to their website, but they are the website where I got those statistics at the very beginning that talk about the number of gun deaths in the US, the specific number of gun deaths in Texas, and then those numbers, relating to firearm injury and the estimated economic toll for the United States. And so they also have this page that they call Not an Accident Index. And so this is a page where they put little dots, obviously, on the map for unintentional shootings by children, and the red are deaths and the blue are injuries. And so this slide is a couple months old, but it shows like this is a lot of dots. And so this is an updated slide. I got this for this week, and so this shows stuff for this year. And when you look at this, it's maybe not as many dots as the last one. The last one was like a full year. This is just like I think a 7-month accumulation. But here we are. This blue dot is Texas, and this is San Antonio. And so if I have not convinced you here that this is a big problem, this dot, there's actually 5 patients sort of all in the dot of Bexar County, but one of those is a 2-year-old boy who on April 27th of this year found an unsecured weapon in his home on top of the television, and he shot and killed himself. And so, reading stuff like this, breaks my heart. You think like, man, had that firearm had a $10 trigger lock on it, this 2-year-old boy, wouldn't be gone. And I think it's also important to understand, and I'm sure many of you do, but this little kid's death, that's a forever thing, obviously. But that's a forever thing for his family, for his friends, for many people that knew him. The ripples of this horrible incident are going to affect a lot of people for a long time. And so, if we can have a conversation in our clinic about safe storage, about how do you get free trigger locks, and we can prevent even one more death like this, to me, it's worth these conversations with families. And so, I think here's one last statistic for you. So, in states that have cap laws, there's 78% lower rate of unintentional shootings by children. And so, to me, that says that this may make a difference for patients, right? When you look at a lot of the firearm injury prevention stuff, it's hard to sort out what makes a difference and what doesn't. And, I tried to read some stuff in preparation for this on like gun buybacks, for example, and maybe they don't work, but then you read, well, 40% of guns used in crimes are trafficked across state lines. So then how do you sort out, laws for one place and the effect they have on other places? And, it's like that spider web I showed. But I think this number shows that secure storage can help. And so if we can help our patients improve safe storage, we can make a difference. And so with that plea, I will, circle back to the clinical scenario and say, next time you're faced with somebody, whether it's someone in your clinic or, wherever, what will you do next time? And if thinking about your answer to that question, I can help with any resources, any facilitating locks or more discussions or resources, please, this is my personal email. Please feel free to email me or email the Safe Kids. That's the injury prevention program here at University Hospital. And then I'll just close on showing you, these are some of the resources used in my preparation for this. And then I'll just leave you guys with a plea to please complete the post survey if you're a UT faculty, resident, or med student. And we really want to know if this education is helpful and what kind of impact it's making. And if it is making an impact, then survey results like this allow us to publish this and help other places hopefully implement similar training programs. And so with that, I will conclude. I'm happy to take any questions that you might have, or clarify anything that may have been unclear. And I thank you very much for the opportunity to come here today and for your attention during this presentation.
Thank you, Dr. Wiggins. For the staff, residents, or whoever's on the audience, I just want to let you know we do have these trigger locks and the cable locks actually in the residency office from previous campaigns and seminars we've done a few years ago. Please feel free to stop by and get them for yourself and for patient you think will benefit from these. Thank you.
That's awesome.
I think there's some questions in the chat.
Let's see. So here's some questions about CME. Yeah. So here's a question that says, in spite of the overwhelming coverage of the tragic killing of elementary students in Uvalde, 60% of voters in that county voted to support politicians who refused to pass legislation to increase the age to purchase weapons of war to 21. How can healthcare professionals advocate for sensible gun safety legislation and environment where fringe elements control decision-making at both the state and national level? And so I think that's a great question. That's a question that I also asked myself after the last election. And I think the answer to that is very complicated, and part of why I am doing this project, because I feel like this is a way that I can maybe make a difference, whereas, you know, trying to sort of jump into the vast political arena is a, you know, very overwhelming thing. But there are certainly physician groups that are very well connected to the legislator. And if anyone is interested in sort of joining forces with some of those groups, please email me, and I can try to help connect you with those groups. Every town has several resources for how to connect with state legislators. They've got some links that allow you to like phone in to your local legislator, to your state legislator, and either talk to the you know, legislative staff or the clerks when there are bills that are being passed that you might have some opinions on. I think, you know, the key from a healthcare community to help with better legislation is make sure that our voices are heard when our elected representatives are passing laws. And so, you know, important part of that is reaching out to them and providing them with our perspective. And let's see. So here's somebody that says, sorry if you already mentioned this. What is the best way to ask a patient or parents for the reason for owning a gun? So I think that's a great question. And this, you know, I don't think there's one size fits all. I think, you know, sometimes what I try to do is approach the subject in a really non-confrontational way for families. And so almost approach the exact opposite way that we approach many other things. So, you know, I commonly tell trainees, you know, don't ask leading questions, like, you know, leave them open-ended so families can, or patients can, you know, tell you in their own words. But sometimes that can be a little intimidating when you're talking about firearms. So, you know, I'll sometimes broach the subject, as I mentioned before. I say, I ask this to everybody, you know, I'm asking this about safety. And then I may, you know, make some other leading statements that say something, you know, to hopefully show the family that I'm not there to judge them. And so I may say something like, you know, I understand that people own firearms for a variety of reasons. Some of those are recreational, some of those are, you know, for personal protection, and I completely respect whatever it is that makes you want to own a firearm. I'm not here to judge that. I'm here to try to help you be as safe as possible. And so I'd like to have a conversation with you to see how I can help you be more safe, because your safety is my priority. And so, that's maybe one example. Bullet points actually has a bunch of other examples. And so, as I think we don't have a ton of time, I would recommend, if you don't leave this conference feeling very comfortable and like well equipped to have these conversations, to explore that further. I mean, you're certainly welcome to email me, and I'm happy to help in any way I can too. But that's another great resource with lots of examples in how to do this in different settings. So I don't know if anyone has any other questions or comments or things I can potentially help with. Oh, here, someone put a link in the chat. It's an email for texasdoctors.org. That is a resource for a local organization that has led efforts to advocate for sensible gun safety legislation.
Well, thanks again, Dr. Wiggins.
Absolutely. I really appreciate being able to come and chat with you guys. And, I hope you all feel empowered today. I am going to say thank you on behalf of hopefully your future patients and their increased safety by all of our efforts to try to make firearm ownership safer here.
Thank you, Dr. Wiggins.
All right. Thank you, guys.